With Zambia having officially confirmed the outbreak of the second wave of the COVID-19 pandemic on the 23rd of December 2020, it has so far recorded over 5,000 cases in less than a month in 2021. A situation that prompted the Zambian government through its former health minister Dr. Chitalo Chilufya to announce that the state will in February start administering the COVID-19 vaccine. But amid this decision, fears coupled with misinformation and conspiracy theories have risen in Zambia and some parts of Africa on whether the COVID-19 vaccines are safer and have no side effects. The skepticism in receiving the COVID vaccine among many Zambians comes after the Ministry of Health recently admitted that it distributed defective health kits to the public, which were supplied by Honeybee Pharmacy at the cost of $17 million.
Who authorized the distribution?
We received information through the office of the PS that we should do, they'll be flagging off the following day by the Honorable Minister of the Distribution. I submit.
So, PS, could you please confirm of what the MSL has just stated, whether that authorization came from your office or not?
Honorable Chairperson, I do not recall. We have two permanent secretaries' offices, and that information did not come from my office.
Many Lusaka residents spoken to by the Red Hot Breakfast crew, as monitored by this reporter, expressed mixed feelings on the accessibility of the COVID vaccine.
Zambia is not among the countries that are badly affected. But then why are we in a hurry to bring in this vaccine?
Since the MPs, they represent us, those guys. So the vaccine, they should be the first people to take the vaccine so that we see how it will work from them.
I think what I think I'm doubt that if this vaccine comes, is it going to be something that I'll be ready to take, because you're looking at all this what's been happening of late. So as for me, I don't think I'm ready to take that vaccine.
We are reproducing the narratives instead of coming up with our own. Research ikamba kuti muno mu Africa ro COVID ngati yabwera. Ma storage sivakambapo. Cold supply chain, how are they going to do it ngati yafika kuipeleka kuma rural areas?
For me, I'll get the vaccine.
Oh, okay.
Even if they bring it today, I'll get it. I don't want to be a hypocrite.
We need to wake up as people that these people might want to just use this for the monetary advantage and not really be that the vaccine is going to help us a lot, and yeah, that's what the problem might be. So
18 vaccines which they are looking at, and these 3 are not part of those vaccines. So the vaccines which will land in Africa and Zambia are not yet known. Only 2 countries in Africa, South Africa and Nigeria, have got a new strain. So let's not rush into being seen. We are creating problems for ourselves.
They must give us an example from Dr. Chilufya. The president, Republican President Edgar Lungu. Let them start with that vaccine so that we see how it works. Then for us, we'll go after 3 months.
Meanwhile, various stakeholders have urged the Zambian government not to be satisfied with the fact that the vaccine is safe until its validation, with the Green Party President Peter Sinkamba saying that the government should first verify the quality of the vaccines before administering it to the public.
we need to verify the quality of vaccines that are likely to come, because they'll be used to vaccinate everyone. We're talking about almost 17 million people being vaccinated. So if they are of poor quality or substandard, we may cause serious problems on the people. So I think this revelation is an eye-opener, and we need to take seriously the issue of verifying various medical kits that are distributed countrywide.
In New Hope Movement for Multi-Party Democracy, MMD President Neves Mumba is of the view that unless the COVID-19 vaccine is validated, verified and scientifically approved by Zambian expert, it should not be injected into any Zambian body, or else Zambians shall die like fools. Meanwhile, governance activist Ruben Rufuka has called on the government to be more transparent in the procuring process, noting that the procuring process will help to discount various conspiracy theories circulating on social media, suggesting that the COVID-19 vaccine destined for Africa is meant for population control purposes and not to protect people against the pandemic.
Whoever receives the vaccine is safe, and to discount the various conspiracy theories that are doing the rounds on social media about the vaccines themselves. So the onus is on government. In much extent that they've been educating the public on COVID, they need to do the same on the vaccine and get that assurance that government is doing everything possible to get vaccines from a trusted source.
Medical for Quality Healthcare in Zambia says awareness creation among members of the public ahead of next month is important, as it will help them understand the significance of the vaccine that is critical to their lives.
This vaccine is going to be administered to the human being, to Zambians. Mm-hmm. So this is the right time. The Ministry of Health should come up with a detailed plan on how they are going to administer, how they have planned on how they are going to use this vaccine. It is very important so that the nation knows the detailed plan, because it will be very easy for everyone to understand. And it's the right time to start now sensitizing people about the vaccine, because so far we still have disinformation about the vaccine.
And in a bid to objectively balance this report, we got in touch with the Director of Infectious Disease at the Ministry of Health, Professor Lloyd Mukonka, who critically explained the procedure with regards to how the Ministry of Health plans to administer this COVID vaccine, its side effects, as well as the misconceptions and misinformation that has come out as a result of this vaccine.
What we are going to receive next month to March will cater for about 20% of the population. And that 20% of the population, again, we've categorized it into the healthcare workers. You people are working and interacting with a lot of other people at greater risk of getting COVID, so you need to have access to vaccines, just like those who are working in the border facilities as well, the elderly, and those who have other infections as well, the same comorbidities we define, diabetes, hypertensives. Then you go now, you narrow down to the general population. We have designed, of course, the implementation pathway, but beyond the 20%, there are also avenues of acquiring more vaccines to cater for the broader population as well, in the private sector and also in the public sector. Are they safe? Every drug has a side effect. But when you look at the evidence which is there, these vaccines, they are safe for administration, just like any other vaccines. There are issues, of course, associated with two types of vaccines, whose mechanism which has been used is based on the modified genetic material of the virus. That mechanism has never been used for any virus. It has never been used for any vaccine in the world. This is the first time. So of course people can be skeptical. That's not the one which we are targeting to be largely or broadly used in the country. We are targeting the one which has used a model similar to the other vaccines like the polio, the yellow fever, which we have used before. And also that one, the storage is friendly enough. You can store it at the regular temperatures which you use for the vaccines. So we are not bringing in large quantities this one, which needs higher cooling temperatures for refrigeration, and also the same one which has this modified genetic material as the model. So yes, the vaccines, they are safe enough. People may have some reactions, like they may have a fever, they may have a rash, and those are reactions which can be treated and they're not life-threatening reactions. We are establishing what is called pharmacovigilance. The patients or the people that receive those vaccines, we observe them over time. When they receive the first dose and when they receive the second dose, we need to look at the symptoms which they develop so that we can learn from there if there are any serious adverse events or side effects are coming.
This has been the Roving Report with Thomas Mwale, reporting in Lusaka, Zambia.